Hi everyone, my name is Tanya Govea and I'm going to be your instructor for the Substance Abuse Certificate Program courses 255 and 260. I use this video for both courses, so if you're taking both, guess what? You only have to watch this once, which is awesome. So just to give you a quick little rundown about myself, I believe this is my 6th year teaching for BCC as an adjunct. I really, really like it. And outside of this, I'm also a LADAC 1, so I am a licensed alcohol and drug counselor. And I have a private practice because I am master's level. And I also have 2 master's degrees. They're not in the clinical form, so I'm not an LMHC, I'm not an LICSW. I have a master's in public administration, and I have one in crime and justice studies. And I end up getting my LADAC just through the years and the progression of everything, that had kind of transpired throughout my, my career journey, which ended up working out really, really well, thankfully. So I've worked in a lot of different settings. I've worked in corrections, I've worked in outpatient, I've worked in residential, and I do a lot of clinical trainings, and I specialize in cannabis use disorders. So I do clinical trainings primarily, but I also will do trainings for, like recovery courts and police departments and, students at their universities and things along that line, because I think that's really important. And it's a lot of fun to do. So there's a lot going on. I'm also a mother. I got 2 small kids. I got 3 cats. I have a house. I have everything. So it's going to be a very busy semester for all of us. And the first thing I want you guys to know is I am a very, very forgiving grader. I'm not one that is like, oh, you don't have your assignments in on Sunday. Like, boom, you're done. Like, you have no access to it. It's closed. You get a 0. Look, I know you're busy. I know I'm busy. And so as long as you get all of the work done before the midterm, by the midterm, you're good. And you get all the work done for the final, before the final, you're good there. I don't recommend that you do it all in like one day, like the day before the midterm, because I'm not going to be able to correct it or grade it properly to give you the feedback that you need. So really, for your own benefit, keep up with the work as much as you can. If you're having issues with it, if you're having trouble with it, please reach out to me and let me know, because I don't want to give you unnecessary stress or anxiety. I don't want to create an experience for you that is not going to bode well. And I want you to be able to really grasp and learn the information that you're getting in both of these courses. For 255 and 260, I try and give you as much real world experience as possible in the assignments themselves. So you're going to have reflection assignments, you're going to have case studies, you're going to have videos. In 260, you're going to get more of a clinical experience. So you're going to be learning about diagnoses. You're also going to be learning about integrated summaries, different levels of care, all of that stuff. With case management, you're going to be realizing that when it comes to clinical work and dealing with people with substance use disorders, it goes beyond just, oh, I'm just doing talk therapy with someone. A lot of people are going to have a lot of barriers going on in their life that are going to have to be addressed in order for them to have positive treatment outcomes, like long-term sobriety, or managing medications in order to maintain sobriety, or whatever it may be, right? So a lot of the case management stuff is going to be learning how to navigate that realm and utilizing all of your resources. So it's going to be a lot, but I've gotten a lot of really good feedback on the assignments and, how they're constructed. Excuse me. And for the most part, you get to give different answers for a lot of this stuff as well. If I give you a case study, every single one of you might have a different response in terms of how you would handle that particular person. And it could be based on your own experience. It could be based on how you interpret the case study and you interpret the client that is being discussed in there. It could be some of your own personal feelings that come to it. So some of these case studies, they shouldn't be triggering. However, they might bring out particular feelings for you guys. And there's some assignments that are going to, prompt you to discuss, what are your initial impressions on this, and how do you feel about it, and would you feel comfortable taking a case like this? So that's something to really keep in mind, is that there's a lot of different variables when it comes to this job, and a lot of different things that you have to keep in mind. But this is where we learn a lot of that stuff, and hopefully you can take this and you can bring it into the clinical field if you're working in it already, or if you're planning on doing your internship, practicum, things along that line, or if you are just trying to discover if this is really the field for you. I don't know, right? So it's all about experience, experimentation, and seeing what works and what fits. And, my goal is to be there for you and to support you and to give you a really great educational experience, and to help you get into this field and be really successful. So please feel free to reach out to me if you have any questions, comments, concerns. If you need any feedback on anything, I really try and be as available as possible. And hopefully, this ends up being a really great year for you. All right, let's get to work.